Very good. Good afternoon, everyone, and welcome. Thank you for joining us today for the National Hispanic Medical Association's Barriers to Transgender HIV Care, NHMA Roundtable. My name is Dr. Gabriel Wagner. I use he, him pronouns. I'm an associate clinical professor in the Division of Infectious Diseases and Global Public Health at UC San Diego, and I will be serving as the moderator for today's event. The National Hispanic Medical Association is a nonprofit association representing the interests of nearly 50,000 licensed Hispanic physicians across the US. NHMA's mission is to empower Hispanic physicians to lead efforts to improve the health of Hispanic and other underserved populations in collaboration with Hispanic state medical societies, residents, medical students, and other public and private sector partners. Today, we are joined by CDC Clinical Ambassador, Dr. Asa Radix, Senior Director of Research and Education at the Callen Lorde Community Health Center, along with President and CEO of the Translatin Coalition, Bamby Salcedo, a prominent and celebrated transgender Latina activist who has also developed the Center for Violence Prevention and Transgender Wellness, a multi-purpose, multi-service space for trans people in LA. We also have Dr. Franco Chevalier, a board-certified internal medicine doctor, current second-year infectious disease fellow at UC San Francisco, who serves as the chair for the board of directors of Latinos Salud, one of the largest nonprofit organizations in South Florida, serving Latino gay men. And we're going to have a robust conversation about HIV within our communities in celebration of National Transgender HIV Testing Day. National Transgender HIV Testing Day is celebrated on April 18th, and it brings awareness to issues related to HIV among transgender communities, including the importance of routine HIV testing, status awareness, and continued focus on HIV prevention and treatment efforts in people who are transgender or gender non-binary. This webinar will be a roundtable discussion with field experts who will have the opportunity to answer questions on transgender health. Everyone who is watching live today, we ask if you have any questions to please drop them in the Q&A box, and we will incorporate them into our discussion or send a follow-up fact sheet with resources. With regard to NHMA's efforts in combating HIV, NHMA has partnered with the CDC's Let's Stop HIV Together campaign to maximize the effectiveness and the reach of the campaign to strategically disseminating culturally appropriate HIV resources to the Hispanic community. HIV/AIDS continues to be a significant public health challenge in the US. The annual number of new diagnoses decreased by 7% from 2014 to 2018, which is great, but Hispanic Latinos accounted for 27% of new HIV diagnoses. In 2020, the CDC released National HIV Surveillance System data for transgender people, and the HIV prevalence rate was 14.1% for transgender women, 3.2% for transgender men, and 9.2% for transgender people overall. In comparison, the HIV prevalence in adults in the US is less than 0.5%. We hope that our conversation today can address the challenges in which members of this population and our community with HIV experience. We aim to highlight the importance of tailored HIV care and treatment prevention services among members of our communities with gender non-conforming identities and expressions. And with that said, I welcome our esteemed speakers for our discussions. Hello, everyone. And we'll start with the first question. Okay, the first question that we can pose to the group is, how does gender affirming care, or a lack thereof, influence a patient's ability to sustain HIV treatment and or HIV prevention? And why don't we start with Dr. Radix?
Thank you for the question. I think first we should just in like 5 seconds talk about what we mean by gender affirming care, because people often conceptualize it in different ways. And when we think of gender affirming care, it's the span of the medical, the legal, the social aspects that help someone to affirm their gender, to be comfortable in their gender. And when those things don't happen, it's very difficult to be able to access really any type of care. We have a huge problem in this country that medical practitioners are completely unaware often of the unique needs of trans people, especially those who want to have medical, and or surgical interventions. So, when you're a person who's trying to access care and you're being turned away at the door, or you're there for an aspect of, gender affirming care and that's not provided, you're probably not going to stay in that place. And we know more and more that, especially for people who are living with HIV, HIV, it's important, but it may not be the #1 priority, right? For folks who are seeking other types of care. So if you're someone, who's in a health setting and they're like, oh, we'll give you antiretrovirals, but we're not going to give you hormones, well, then find somewhere else to get your care. So it does impact whether people enter into care and whether they stay in care. And I think you can hand it over to someone else.
Dr. Chevalier.
Yeah, thank you so much again for having me. I think what Dr. Radix is saying is completely true. And I think I'll add the perspective of the HIV care that I provide currently in my fellowship. When I see members of the transgender community or just within the LGBTQ spectrum, I think one of the biggest things that this particular community faces is the inability to have equality and equity when it comes to access to healthcare. Depending on where you are regionally, care completely differs. And so one, from the knowledge of providers to even deliver that kind of care or to even understand sort of like the particular needs of that community. But I think more specifically also just like from a patient perspective, the stigma that they face, sort of like the discrimination and just the access or availability of medications, and just the support system that they need, not just from the medical perspective, of the socioeconomic perspective, the mental health perspective, and all of these different things. Unfortunately, it's not equal across the continuum. And so I think that that's really the unfortunate sort of lack that we have when it comes to sustaining individuals for HIV treatment, but also prevention. And the last thing that I would also add from the perspective of HIV specifically is also the lack of knowledge from a lot of providers, across the continuum as well. Again, all regionally, depending on where you are, they may not know what particular things or needs patients may need, or what sort of choices they have in terms of PrEP, in terms of HIV treatments and other options as well. And I'll stop there just for the sake of time too.
Bamby.
Bueno, primero que nada, yo quiero dar gracias a mi poder superior por darme la oportunidad de tener un día más de vida y también honrar la presencia de todas las personas que nos encuentran y definitivamente honrar la tierra en la cual nos encontramos. Greetings, everyone. My name is Bamby Salcedo, and thank you so much for the opportunity to be here. For those of you who were not able to understand, I honor my higher power for giving me the opportunity to breathe one more day. I also honor the land where we're standing today, and I'm greeting you from Tongva land in Los Angeles, and certainly honor your presence for joining us today. Gender affirming care, I would say, it's about equity. It's about affirming. It's about, really understanding, people like myself, right? And I certainly want to, express my appreciation to, to Dr. Radix and Chevalier for being, leaders, being at the forefront, right? Like specifically supporting our communities. We know that, for the reasons that were expressed, many transgender, non-conforming, intersex people don't necessarily go to clinics to access care. In fact, we did a study in 2018 that is called the State of Trans Health, specifically here in Southern California, to try to understand the health needs of transgender non-conforming intersex people. And 99% of them reported that they go to see the doctor in the emergency room, right? Because of the continuous discrimination, because the lack of understanding and the different things that people already mentioned, right? And so this is a reality that we experience. And I think it's also important to highlight, especially now, everything that is going on around the country, right? I mean, just a couple of days learning that, the Missouri is criminalizing for, trans people to have access to healthcare, right? And so, they even have a website that the Attorney General put for people to make complaints, right? And so this is, the experiences that we have to endure, right? When we are criminalized simply because of who we are. And obviously, when healthcare is denied to us simply because of who we are, it definitely, impede for us to access the services that we deserve and, and should have, right? Because healthcare, it is a human right and, should not be denied simply because of who we are.
I guess one follow-up question would be, how important is it to co-localize HIV treatment and prevention services along with gender-affirming care, or how feasible is it?
Are you asking me or just
anybody can take that?
I mean, I guess I'll just add a little bit, and obviously I'll let our amazing doctors here to bring the professional perspective. But I think we need to look at the broader picture, right? Because HIV prevention and care, can really happen if the social conditions of transgender, non-conforming, and intersex people are addressed, right? Again, it was mentioned that we don't go seek care if we are trying to figure out where we're going to stay tonight, what are we going to eat and stuff like that. And so I think it's important that we do really pay attention to that when it comes to members of the transgender, non-conforming, intersex people, right? Because if the social conditions that continue to put us, being a community that is in despair, essentially, right? Everything else becomes secondary. And so I think we need to really look at the broader picture and really figure out how we are intentionally going to invest in the livelihood of transgender, non-conforming, intersex people so that we can move the needle to where we are situated within our society so that we can ultimately and hopefully have better qualities of life.
Yeah, I also, oh, sorry, go ahead, Dr. Radix, I'll let you go.
Yeah, Bamby, thank you so much. And I agree, we often talk about, co-location of services. I mean, yes, it is important for folks who are delivering HIV prevention and treatment as clinicians to be completely knowledgeable about, hormone prescriptions and monitoring, things like that. But I really so appreciate what you said. When we're dealing with folks who are facing housing or food insecurity and all of those issues, like often those get pushed aside, right? It's like, oh, as long as I give someone hormones, they're going to come and get their care. But, it's just not true. And there are a host of those issues that you talked about that are important. But then how do we as clinicians improve that? And I'm going to look to you, Bamby, because I think a lot of what we should be doing is partnering with community organizations and ensuring that folks get the holistic services that they need.
Yeah, totally. I'm going to echo what Dr. Radix and Bamby have said. And I think that, as a provider myself, I think that we have to recognize sort of the social stigma, the discrimination that happens as a whole. And I think first and foremost, really the healthcare portion or the HIV treatment is just a small piece of the pie here. I think that, neglecting the other facets of what makes a human being and a patient, really comes down to the fact that as providers and also as a healthcare system, we oftentimes neglect the fact that adherence to medications is just the last thing on people's mind when they have to figure out where they're going to sleep the next day, when they have to figure out if they're going to eat tomorrow, where they have to figure out if they show up to work tomorrow, are they going to be discriminalized or are they going to be fired? And so I think we should do a better job in terms of not just finding ways to sort of deliver care in a way that, oh yeah, you're here for your hormone treatment or your hormone therapy, and here's your HIV treatment. But beyond that, just kind of look at what are the barriers that are inhibiting this individual from showing up consistently, from taking their medications, from being virally suppressed, from feeling empowered from being virally suppressed, and understanding what that means as a whole, and how that supports their lifestyle and their overall just quality of life. And I think that in some ways kind of challenges physicians and providers in the healthcare system to just really try to understand and really try to engage with the community and just be advocates, from the policies to just like the way that guidelines and policies are done in the clinic, but also just as a whole in their cities and states as well. So I would just end it there because I think that that's really the most important thing, is just having that insight and understanding that it goes beyond just the medical part.
Thank you. All right, let's move on to the next question. There's a lot of tail pieces that we can spin off of here. But why don't we ask the following question? How do you foster a safe space and incorporate patient-centered care when working with transgender patients? And this is this kind of goes a little bit in line with some of the issues that we were bringing up earlier. And so why don't we have Dr. Radix begin? I believe you're muted.
I'm right here. There are so many, aspects you can think about. There's a lot of work that's been done in this area. The entire agency, the entire, establishment needs to understand the concept of trauma-informed care, and that applies to everyone. I have to say, it's the ability to understand that everyone is coming in with a story, that they may have faced previous trauma, and to ensure that all your settings are created in a way that recognizes that. And I would say that the conversation starts even before people walk into your center, because people hear, right? They hear about other people who've maybe had a bad experience. They call on the phone and they're misgendered, right? That's like maybe their first interaction with your setting. So you really need to think about every different way that people are going to touch your facility. But at a minimum, to just walk through and think about how, when trans people walk into my center, what are they confronted with? And maybe it's a registration form that doesn't allow people to actually write down the name that they use for themselves. Maybe it's a form that doesn't allow people to put their gender identity in addition to assigned sex at birth. They look at the images on the walls and they don't relate because they're cisgender people, or other maybe they're all white people, for example. I mean, again, I think this is for everyone. And training stuff, we often think about the clinicians, the providers, but most of the poor interactions I'll say I've had in healthcare settings have been when I first walked in. I mean, there's no provider in sight. So, everyone needs to be aware, everyone needs to be trained. And again, like ensuring that as you're doing that first intake, that you find out what are all the things that folks need. If is their first ever visit to a clinician because they've had poor experiences, or they've been afraid. Having someone come in and they're hungry and you're trying to draw blood from them on the first visit and they haven't had anything to drink, serves no purpose. So I would say, training, just thinking about all the systems that are there and ensuring that you have people of trans experience to show you where there are gaps, because that's probably the most important thing.
Dr. Chevalier?
You know, I always like to put a plug for the clinic that I work at right now, which is Ward 86. And Ward 86 here is this historical HIV care center here at San Francisco General Hospital, literally across the street. And I love this place because I trained and did my residency in South Florida, was in Chicago, and also grew up in Atlanta when I moved from Dominican Republic. So you can imagine that I have an array of exposure to just very different practices when it comes to just like transgender care. Actually, lack of practice or lack of engagement, because in some of these places, there's really no curriculum or no setting where you actually get to train with these patients, specifically where you are. But being in San Francisco has really allowed me to really truly dive into what it is what embodies transgender care, what embodies transgender HIV care as well. And what I love about this particular clinic is that the first thing that I had to do as a provider was to really check my ego and my assumptions, because just because I am a gay man, person of color that is within part of the community, I really don't understand a lot of the struggles and the things that transgender individuals go through. And so understanding that, coming with that insight and knowing that I have to check my pride and also my privilege within the community, it's number one. And I think that one of the things that I have gained from just interacting with patients from the transgender community is that there is no one way to be transgender. That's number one. And I think that as staff members and as providers in general, we have to understand the diversity that exists within the transgender community. Just because someone might be a transgender woman doesn't mean that they might necessarily portray themselves as like a feminine person or a masculine person. So understanding even those varieties really makes a difference. And I think as a community, what I love about this clinic is that we really make a job of making it known that, for instance, restrooms are unisex. Anyone can use them. The verbiage and the signage, like Dr. Radix was saying, embodies really, truly the population that we serve, the staff members that we serve, and people can see themselves to the staff members that are there, the providers, and just everyone from the receptionist to the janitors and anyone else that's there as well. But I would also say, like, just even if you are not part of the community, just being an ally and trying to get familiar with the terminology that is used within the community, understanding what people say when they're like, I'm intersex, I'm transgender, I'm AFAB, I'm AMAB, and things like that. And just knowing those things really allows these patients to feel welcome and to feel understood and to feel like they actually have a seat at the table. Because at the end of the day, you have to look at this patient population as stakeholders, right? They're coming to your clinic, they're coming to your hospital to try to get support. But at the end of the day, you need them just as much as they need you. So it's a feedback mechanism, in my opinion.
Yeah, definitely training, as Dr. Radix was saying, of training and education of not just the clinicians, but everyone in the environment, everyone. Bamby.
Yeah, thank you again for this questions that I think, I want to invite those who are present and those who are going to be listening at some point, right? That we are in 2023, right? Trans people are visible, and trans people are, we are integrated into the tapestry of our society, right? And so, for medical settings and particularly doctors, right, to really try to ignore the reality that we exist is not sustainable, right? And I think we need to really understand, why is it that we became doctors, right? My understanding is that doctors make an oath, right, to really support people, in general, right? And so their oath is not to say like, I'm gonna, discriminate, I'm gonna eliminate it, or I'm gonna be biased against, people who are different, right? And in this case, transgender, non-conforming, intersex people. And so I think we need to really do a conscientious effort, right, for us to change the way we do things, right? The status quo is not going to work. And so we really need to get with the times, and we really need to be intentional about our work. And for those institutions, right, like particularly hospitals, we know that they are primarily are religious based, right? Examples, there's hospitals that are named after saints, right? And so there's a lot of like correlation there. And so we really need to pay attention to that, and we really need to ensure that, that policies like federal policies and policies that have been in place, we implement those into our institutions and we roll them out and we actually, execute them in a way that we're holding people accountable, right, for interactions and for, for the way we treat people, right? And so I think we are at a point to where like we need to move beyond what we have been talking for the past 30 years, right? It really is about understanding that we as members of the community who are part of the transgender community, intersex people, right? It is a right to have access to healthcare. And so we need to really eliminate all the personal biases, the religious beliefs, and all of those things that influence to ultimately treat people the way we treat people.
Yeah, and I don't know if everyone here has seen the video Vanessa Goes to the Doctor. I think it was produced by the National Cancer Network. I don't know if y'all have seen it. It's very tongue. Oh, it's great. You should. We have a curriculum, health elective for first and second year medical and pharmacy students at UCSD, intersections of LGBTQ health elective, and this video is great. And in fact, it actually got incorporated to the general orientation beyond the elective for all incoming UCSD medical students. But anyway, in the video, you can find it on YouTube. They do a great job of, an example of like a bad exam or of a bad, clinic visit and a good clinic visit as Vanessa, a transgender woman, goes to the doctor. And, definitely the importance of a welcoming environment is key to establishing the trust of all patients. And my plug is for the Owen Clinic at UCSD, which is the largest HIV provider in the region. And yeah, we have the trans flags draped on the walls, but yeah, I think you definitely don't have to even go that far to provide a welcoming environment with many little things. And we all know that the interactions are happening even as you step in the door. So definitely important. How about, why don't we talk a little bit about PrEP? So we know that there is an underutilization of PrEP among key patient populations. What are the major factors contributing to the underutilization of drugs like PrEP for transgender populations? And how do barriers to health education or barriers to access to these medications play a role? Why don't we begin with Dr. Radix?
Thank you. So, there's underutilization across the board for most populations who need PrEP. But as you did point out, it's even more so for trans and gender diverse folks. In fact, I think that the latest number is like less than 15% of folks who should be on PrEP are on PrEP. And, obviously a host of reasons, but I'm going to start with a big one is that providers, clinicians are not recommending PrEP. If you ask people, why aren't you in PrEP? No one told me about it. Well, you're seeing a provider. Why didn't that happen? Perhaps you had, were diagnosed with an STI in the last few months, yet no one spoke about PrEP. Or maybe you went on post-exposure prophylaxis because of, a possible, because of HIV risk and encounter. And yet when you finished it, no one offered it. So I would definitely say, as providers, we need to also know that. But yes, I mean, there's obviously medical mistrust. There are data that show that people often are worried about interactions with hormones if they're on hormones. I haven't myself seen that with clients. Obviously, PrEP stigma, HIV stigma, all of these issues can play a role, and we need to do much better at ensuring that we have materials and flyers, brochures, advertising that shows that people who are on PrEP are not just, like cisgender gay men, that all people, can use PrEP. So, we have a lot of work to do.
I think you're muted, Dr. Wagner.
Hello, can you hear me? There's definitely that intersectionality of stigma that you mentioned. Which is important when it comes to PrEP utilization. You mentioned stigma associated with HIV, with gay or trans, the stigma associated with PrEP itself, right? Many of us may have heard the term Truvada back when Truvada was the only FDA-approved medication, because it was presumed that someone would be sexually promiscuous as a result of using it. Dr. Chevalier.
Yeah, as you all have said, this is sort of like my area. My biggest passion is prevention and PrEP. As a matter of fact, most of my research and sort of like contributions in the community really dive into prevention. And so, I can talk about this all day long, but as Dr. Radix says, the uptake of PrEP across the board in the US is relatively low, considering the fact that we have either roughly about 1.2 million people in the US that could benefit from PrEP. And then when you think of the global burden of HIV prevalence in general, I was looking at data that suggests that transgender women in general, globally, make up about 19.1% of HIV prevalence or HIV infections. And then when you break it down further, think in places like the US, for instance, the vast majority of those individuals that are, within part of the transgender women community, people of color, when you think of Latinx and African-American transgender women, make up about 44.1% of the HIV infections within the transgender community. And so those are huge numbers. And I think that we should do a better job at not only just getting educated about the forms of PrEP and the PrEP toolkit that we now have available, because we have so many different exciting things that are happening right now when it comes to PrEP, but more so just really identify the lack of research that really is going on into these communities. I think that the lack of representation in a lot of these major studies that have looked at PrEP in terms of adherence, in terms of the way that these things interact with other medications, but just in terms of how the acceptability of these communities as it relates to these medications, it's really something to look at. I'm a big implementation science researcher, and I feel that we really lack a lot of how do we implement these programs and how do we implement strategies to increase uptake of PrEP within the transgender community. And I think, to the point of Dr. Radix, a lot of providers really don't know the options that are available or even make it known to the transgender patients, like what options they have, from understanding that, hey, this is an option for you. Now we have injectable cabotegravir that people can take, and now we're looking at lenacapavir, which is a potential medication that will come out one day and hopefully will be administered every 6 months, and so we're enrolling people in these kinds of trials and looking at different venues of prevention. And I think that making sure that people feel represented and seen, and that there's an actual genuine concern, not only from providers, from the community as well, to really engage them into the research, but also engage them into getting understanding what options they have and really actively taking ownership and participation in these particular strategies as they go to the communities. Because I think the biggest factor that really influences uptake is seeing people and having people that represent them, right, to try to promote these strategies and talk about them.
Thank you, Bamby.
Yeah, so again, just having taking a pill or an injection, right, is not going to solve the broader issues that our community continues to face, right? And so, that's why we as an organization are very intentional in the work that we do. And we are currently providing accessibility to PrEP to members of our community. And so, but what we also do is we support people with emergency housing. That's why we have a transitional housing program. That's why we have a emergency housing within that house. And that's why we also provide, gift cards to toiletries or, or grocery cards for people to be able to buy food. That's why we do peer navigation. We actually take people to, to these clinics. That's why we also, if people need a phone, right? Like that's why we do. And mind you, some of these things are not included in grants, right? And so I think we need to look at the broader picture to address those things, right? I mean, there are trans women, for instance, who are getting out from immigration detention, who don't have anything. Like some of them like come out in jumpsuits, right? And so we take them to the store to buy chones, to like take them into like have some decent food, right? Because some of them have been incarcerated for months, and we know that the food that people provide in those cages it's horrible. And so we try to give some decency to members of our community, right? And so again, we need to really think about like how are we designing programs that are not just to make sure that people are having access to the pill or to the injection, right? But how are we really addressing, right? Like a lot of times we talk about holistic care, right? But we don't do anything about it, right? And so I think that there's definitely a partnership that needs to happen between, the government and the, and the entities who are like around healthcare, and also like to implement legislation that really looks at holistic care as it is, right? And so that we're not just talking about, so that we are actually, putting money where our mouth, or what do you say? Like put the money where to what you're saying. I don't know how to say it in English, but it's about, put your money to your mouth or whatever, something like that. But that is what needs to happen, right? Like we need to really think about people. We really need to think about like, how is it that we are going to support those who are the most marginalized, those who are the most at risk, those who are, the ones that we, our society thinks are disposable, right? And so trans people fit under that category. And so, we need to really, if we believe in social justice, right? If we believe in, human rights and the rights of people to have access to healthcare, right? We need to look at the broader picture and really do an intentional investment in the livelihood of our people so that we can move our people into become healthy individuals.
I just want to say, Bamby, thank you so much for saying all of those things. And I think it also highlights why we're also worried about this legislation that is just going through state by state, just, preventing people from living their lives. And it obviously it's going to happen, well, not where you are, because you're not in a state, I think, that you need to be worried. But what's going to happen?
I mean, that's definitely an argument to be made.
Okay, but what's going to happen when the funding stops to organizations that are doing this work? What's going to happen when providers are just too afraid to even say the word trans in their clinics, because who knows, they might get shut down, or they have to take away some of the affirming policies that they have in place. I think these are going to have dire consequences for, especially for HIV prevention and treatment.
And I'll even take it a step further from everything that you're saying, just thinking of the psychological trauma and stress that all of these things create, it's just adding more fuel to everything, to the fire, right? And so, I completely agree with what Bamby and Dr. Radix are saying. This goes beyond just having access to a pill or to an injection. It really expands to truly looking within ourselves, like how can we be supportive as a community, as a country, as a global entity? Because right now, the climate is very against it, and it's a scary place, and it's a scary situation to be in. We've made so much progress, and it feels like now we're taking like 10 steps back, and it's like, how did we get here?
Well, the truth is that, right-wing extremists, right, are murderers. And I'm saying they're murderers because they're spirit murderers, right? They are murdering the spirits of our people, right? But we're not going to let them, We're going to continue to fight, and we're going to continue to resist, and we're going to continue to make sure that, do everything that we can to continue to, to affirm our resistance in this world, right? So, even though it's scary, right? Like, transgender and conforming intersex people have, since the colonization have been under attack, right? Through the indoctrination of, our peoples and everything else, right? Like, they try to erase us from there. And so this is not new, but it's more like in your face, right? It's more of like noticeable because, media and because of social media and everything else, right? But they have always tried to, eliminate us, but they're not going to be successful. And, we are going to continue to fight, and we're going to continue to just keep our spirits alive, right? Despite the fact that they're trying to murder us.
And we did get a question on the Q&A box, which ties into what we were just talking about. Can the panelists speak to the impact of anti-trans legislation on HIV testing, PrEP utilization, and ART adherence? Not sure if folks have other things to say.
I mean, I can chime in terms of at least, just HIV treatment adherence and just HIV, testing in general. From a medical perspective, I fear that this is going to create a negative impact in adherence in many ways. One, from the fear that's been instilled in the community, and also just in general, the mistrust that's being created through all these regulations and all these laws and all these bills that are being passed on. As we create this environment where people, providers alike as well, become fearful of having to welcome someone just because of who they identify as or who they may express themselves to be. It's so scary to even think that now all of a sudden you cannot welcome someone just because of something so silly, and it's crazy to even think that this is being passed on to the younger generation that's going to be adopting these kinds of things. Because as you think about the future of medicine, when you think about the future of just like the world in general, these are things that, it's generational trauma in some ways that people just kind of uptake and sort of pass on. And so it is a scary place, because I think that the more that these things are being introduced, the more that we're going to see the numbers going down in terms of HIV medication adherence in testing and things of that nature, just because of the mistrust that's being created all across the continuum in healthcare, but just in general across the nation as well.
I mean, the impact on mental health and wellness is immense. The fact that states are pulling away even, whether you can change your the gender marker on your birth certificate, your driver's license. I mean, there's states now not allowing people to have a non-binary gender marker if they're non-binary. And, it makes it that you don't even want to get up in the morning. And we've seen waves of this in the past, but now it's reaching levels that, are unprecedented. The fact that, you're living in fear that your access can be pulled. I'm sure you remember back when, Medicaid started covering gender affirming care. So people finally, for the first time, had access, if they wanted it, to hormones and surgeries and so forth, and affirming behavioral health and so forth. And now the fear that you can actually see it on the calendar that this is going to be removed from you maybe in 20 days or for many people, I think that they're going to feel that there is nothing to live for, because all their rights are being taken away. And I don't know what the solution is. I mean, we can't just say, oh, move to another state or move to another region. That's just not a possibility for people. sustainable. You can't uproot everything, although I know people will be. But it's not a sustainable solution.
Well, I mean, that is displacing people, right? Like they're forcing people to move, right? And so, but I mean, you mentioned, we're here in California, right? And I think even here in California, like we are experiencing attacks in our community, right? I mean, just, in Hermosa Beach, there was, a motion in city council to criminalize putting the pride flag. You know what I mean? Like it was just, and it really depends where you go in the state, right? Like you can go to Orange County and super red, and you can go to like Central California super red, and it really depends. But that is why we need to fight, right? And also enact legislation, right? That is very specific of our community. That's why we, as an organization, introduced here in California, Assembly Bill 2218, which is the Trans Wellness and Equity Fund, in which the governor assigned $13 million for health services, and that includes also training, and that includes, specifically for trans-led organizations to be able to have access to this money, right? And we're looking at health on a broader aspect, right? Like not just healthcare or physical, if you will, but we're also including the arts as part of that. You mentioned mental health, so we know that the arts is a vehicle for healing for our community, right? We're also even including housing as a health issue, right? And so I think we have to do those type of things. We as an organization are also serving as a model for other trans-led groups and organizations, right? I think last year in New York, New York also passed a piece of legislation. They didn't get a lot of money, but they got some money, right? But it sets precedents, right? I think they got like $3 million for health services in New York, and so I think if we can do that in different ways, that's definitely a way to also combat that. But I also want to say that through the work that could be done, I think we also need to make sure that there is this partnership, right, between the private sector and organizations that are doing the work, right? We know that there's a lot of money in philanthropy, right? And so they need to step up and really, support our communities, right? They have, many of those companies have voice in our community in different ways. And so like they need to really step up and support our community the way that we need to be supported. And so we just need to find ways to like strategize and make sure that, we tap into the resources that we need to do the work that needs to happen, right? Because it is not sustainable for us to, continue to do the work with no resources, right? And so I think, the private sector also has a responsibility, to support our communities the way that we need to be supported.
Going back to the changing nature of this environment that we work in, we actually have a question another question on the Q&A box. How can providers support their patients during this time? And how can they support each other? Dr. Radix?
So I'm going to take the second one, which is how can providers support each other? There are groups of us who meet and talk about these issues. I think you need to surround yourself with folks, obviously, who have the same mindset, who have the same concerns, and think about how you can work together as advocates. I'll say that for many people, when I said it's hard to get up in the morning, for many people, it's just like, I'm just going to leave the country. I can't stay in the United States anymore, or I'm going to switch. I'm just not going to do medicine. I can't work in that environment. But, I don't think that's the best approach. I mean, I think we need to be working with each other and with members in the community to see what we can do, whether it's writing letters to legislators, whether it's figuring out how to do fundraisers for community-based organizations, something that will get you up, get you motivated, and get you fighting. I have to say it's hard to say that because many days I don't feel like fighting. I feel like we've maybe lost the battle. But my colleagues who are continually sending texts and messages and getting us all into groups has been, really essential. And there are organizations, I'll say, like for example, like the WPATH, which is the World Professional Association for Transgender Health. There's also USPATH, which is the US chapter. They do provide education. They also, they have conferences and seminars, but they also do advocacy, and they have, they do respond to a lot of these attacks by, amicus briefs and so forth. So I would say get involved, There's nothing better than getting involved in some way.
Anybody else wants to jump in?
Can you quickly remind us of the first part of the question, Dr. Wagner?
The question was, how can providers support their patients during this time? And the follow-up, how can providers support each other?
Yeah, I'll take a stab at the first part. And I think, and this is only speaking from my personal experience, but I also think that that's one question that's better answered by the patients themselves and the individuals that are seeking the care, because I think that each individual that steps into a clinic or in a hospital setting has specific needs. And I think for me, it's just assuming, it's like taking away the assumptions that I know exactly what their needs are. I can give you a specific example of, for instance, patients that come into my clinic and like Dr. Radix says, they're not looking to take a medication. They're just like, listen, I am aware of my status, but right now my needs are this. And this is how I want you to support me. And understanding and meeting people where they are, whether that is housing, whether that is, they need a car for transportation, whether they need support with having stability in terms of like where they can keep their stuff, whether that is, I'm unemployed right now and I'm trying to get, I need to get a job, or I need counseling, and trying to support them not only just from the medical perspective, but also understanding that it really takes a village and a team. And so trying to pair them up with individuals like social work that is more familiar with understanding the process of like housing and figuring out all the social perspectives and things that these patients necessarily need, or counseling services, and just having the support system, and even things like Bamby was saying, like a meal. Right? Sometimes they're coming into my clinic and they're like, hey, I haven't had anything to eat. And so having staff members and having the availability to be able to provide them with a meal, all those things can make a difference. But I think that, again, it's just really understanding that every single person that walks through the door has specific needs. And as such, you should not have one way of doing things. You should have a variety and have a team that is willing and able to support the needs of specific patients that come into your clinic.
Bamby, anything to say?
Yeah, no, I mean, I think, it's kind of like the same thing. I think it's important to really affirm people, right? So we're talking about, affirming care. And so, for those who are service providers, right? Just affirm people, right? Just, don't dead name, don't misgender people, don't, you know what I mean? Like, just, those things are things that literally kill our spirit, right? I mean, there's research that says that when people are misgender, like it impacts you psychologically, right? And so, simple things like that could go a long way, and if you're not in this line of work for the right reasons, then find something else, like seriously, like I think, again, we're in 2023 and, there's no room for BS, just for the lack of a better word, right? So just get with it. You know, that's, you either get with it or get out.
Okay, we're starting to approach the top of the hour here, and unfortunately, I think we're starting to get more and more questions, but I think we'll just probably have time for one more, and this is for Bamby specifically. In your experience, what are the most pressing needs, health concerns of transgender Latinas, specifically newly arrived immigrants, and what do you suggest be done to address these?
What are the pressing needs, and what
are the most pressing needs, health concerns of transgender Latinas, specifically newly arrived immigrants?
I mean, there's so many. Where do you want me to start, right? Like, I mean, I think, you know, it really depends, right? So for many, we did a study also in 2012. It's called Transvisible, and people can find it on our website, like all of the studies that we've done. But yeah, well, you know, particularly trans women, right? Like, they leave, the majority of us leave our countries because of the violence that we experience, right? And so, you know, when we're trying to save our lives and we get to a different country and we're incarcerated by trying to save our lives, right? In other words, we're put in immigration detention. And then, you know, then we experience violence in there. And then, you know, we don't have families, we don't know the language, we don't know the culture, right? And then we're released to, you know, wait for a court date in 3 years with no documentation, with no nothing. And so the system pushes us to continue to be in this recidivism process, right? That happens, that push us to engage in the street economy for us to survive, right? So all of that, and then plus, you know, the criminality of us being trans and immigrants and monolingual Spanish speakers, you know, or other languages, right? And so, I mean, there's so many, and that's why we exist as an organization, right? Like, to support our people. And that's why we are, you know, that's why there's 40 of us beautiful, amazing, trans-identified, gender nonconforming, and intersex people working here at our organization, you know, to support and craft programs and services and influence change in the institutions that continue to marginalize us. And so, you know, we're here to, you know, address those issues, and to really uplift and support the livelihood of our community. And so, yes, I mean, there's so many issues. So, you know, we also support people who are incarcerated, right? Like, we put money in people's books who are in immigration detention, and, you know, we have clothes, we got food, we give lunch every day. We have a multiplicity of services, including legal services here. You know, we have a team of lawyers who support members of our community with their legal cases and stuff. Again, we do wraparound services, so we do holistic care. The way we look at HIV is it's in a holistic way, right? Like, if we're able to put somebody on a house, or like get somebody out from the streets, right? That is an HIV prevention, right? That is the possibility that somebody will take a test, right? If we give lunch, you know, to someone, even if it's just one meal a day, it's a meal that, you know, they can perhaps take them away from doing other things, right? And, you know, other things. So, in other words, you know, time is off, but yeah, sorry, I think you probably want to close.
I think hearing your voice, Bamby, is actually probably invaluable to everyone on today's call. But yes, why don't we bring it to a close? So firstly, I'd like to thank our guest speakers for their time and expertise on today's topic, as well as our live audience for participating today. A recording of today's discussion will be added onto the NHMA YouTube page and website within a week. Please keep in mind that resources on HIV prevention, treatment, and care are available for both physicians and patients in the hispanichealth.info website as a toolkit tailored to your health needs. We hope that everyone enjoyed our informative conversation. If you have any questions regarding our HIV program, please reach out to our program manager, Jason Hernandez. And thank you all again, and enjoy the rest of your day.
Thank you, everyone. We'll see you soon. Bye.
Thank you so much.